Musiclist.io. Music licensing reimagined.
Welcome back to Support Talk with Cecilia. Obviously, I'm Cecilia. Sorry I didn't do my video yesterday like I usually do. I was under the weather. I wasn't feeling good. I'm still not really feeling good, but I feel better than I did yesterday, so I figured I'd just go ahead and do it today. I'm going to do bipolar this week because I did borderline personality disorder last week, and it kind of has similarities. There have been people that have been misdiagnosed that actually had borderline personality disorder that was diagnosed with bipolar, and vice versa. Me, I have been misdiagnosed, but come to find out, I actually have a mixture of both. So, but let's jump right into it. Some people wonder, what is bipolar disorder? Well, I'm getting ready to tell you. Bipolar disorder, also known as manic depression, is a mental illness that brings severe highs and low moods. A change is in sleep, energy, thinking, and behavior. People who have bipolar disorder can have periods in which they feel overly happy and energized, and other periods where they're feeling very sad, hopeless, sluggish. In between those periods, they usually feel normal. You can think of the highs and the lows as two poles of mood, which is why it's called bipolar disorder. The word manic describes times when someone with bipolar disorder feels overly excited and confident. These feelings can also involve irritability and impulsiveness or reckless decision making. About half of people during mania can also have delusions, believing things that aren't true and that they can't be talked out of, or hallucinations, seeing or hearing things that aren't there. Hypomania describes milder symptoms of mania, in which someone does not have delusions or hallucinations, and their high symptoms do not interfere with their everyday life. The word depressive describes the times when the person feels very sad and depressed. Those symptoms are the same as those described in major depressive disorder or clinical depression, a condition in which someone never has manic or hypomanic episodes. Most people with bipolar disorder spend more time with depressive symptoms than manic or hypomanic symptoms. So going back to what I said about bipolar and borderline personality disorder being the same, and borderline personality disorder, you can have extreme highs and extreme lows as well. You can also have risky behavior, reckless decision making, and stuff like that. So that's a way that borderline personality and bipolar disorder, people can be misdiagnosed for them. So yeah, that's how they intertwine. But some people wonder if there are different types of bipolar disorder. So here are the types of bipolar disorder. There are a few types of bipolar disorder, including bipolar 1 disorder. This is with this type, you have extreme erratic behavior and manic up periods that last at least a week or are so severe that you need medical care. There are also usually extreme down periods that last at least 2 weeks. Bipolar 2 disorder, this type, you also have erratic highs and lows, but it isn't as extreme as bipolar 1. Um, uh, this word I'm gonna have trouble kind of saying, so bear with me. Cyclothymic disorder. This type involves periods of manic and depressive behavior that last at least 2 years in adults or 1 year in children and teens. The symptoms aren't as intense as bipolar disorder 1 or bipolar disorder 2. With any type of bipolar disorder, misuse of drugs and alcohol use can lead to more episodes, which means with alcohol or drug use, it can make your episodes a lot worse. Having bipolar disorder and alcohol use behavior, known as dual diagnosis, requires help from a specialist who can address both issues. So there's the types of bipolar disorder. The symptoms with bipolar disorder are, in bipolar disorder, the dramatic episodes of high and lows moods do not follow a set pattern. So with your highs and lows, it doesn't have a pattern. You never know when you're going to have the highs and the lows. Someone may feel the same mood state, depressed or manic, several times before switching to the opposite mood. These episodes can happen over a period of weeks, months, and sometimes even years. How severe it gets differs from person to person and can also change over time, becoming more or less severe. Symptoms of mania, the highs, is excessive happiness, hopefulness, and excitement. Sudden changes from being joyful to being irritably irritable, anger and hostile. Restlessness, rapid speech and poor concentration, increased energy and less need for sleep, unusual high sex drive, making grand and unrealistic plans, showing poor judgment, drug and alcohol abuse, becoming more impulsive, less need for sleep, less of an appetite, larger sense of self-confidence and well-being, being easily distracted. During depressive periods, these are the lows, a person with bipolar disorder may have sadness, loss of energy, feelings of hopelessness and worthlessness, not enjoying things they once liked, trouble concentrating, forgetfulness, talking slowly, less of a sex drive, inability to feel pleasure, uncontrollable crying, trouble making decisions, irritability, needing more sleep, insomnia, appetite changes that make you lose or gain weight, thoughts of death or suicide, attempting suicide. Most all the highs and all the lows I've experienced. So if you have any questions for symptoms you're experiencing with bipolar disorder or anything, you can comment below and I will get back to you. I will answer any questions you may have for any of my videos I did. And if I haven't done a video on something that you have or you think you have and you want the information, please comment below because I will take requests. If you request me to do a video, even if it's not mental health, if you have say a chronic illness, chronic pain, anything, and you need information and you want me to do a video on it, comment below. I'll take requests on videos. It don't need to be mental health. Um, Anything you all want me to do, I will do. I will look up, I will get the information and I will do a video for you. So if you need information and you have a request, just comment below and I will do that video. There is no single the causes of bipolar depression. There is no single cause of bipolar disorder. Researchers are studying how a few factors may lead to it in some people. For example, sometimes it can simply be a matter of genetics, meaning you have it because it runs in your family. The way your brain develops may also play a role, but scientists aren't exactly sure how or why. The risk factors for bipolar disorder. When someone develops bipolar disorder, it usually starts when they're in late adolescence or younger, or young adulthood. Rarely it can happen earlier in childhood. Bipolar disorder can run in families. Men and women are equal likely to get it. Women are somewhat more likely than men to go through rapid cycling, which is having 4 or more distinct mood episodes within a year. Women also tend to spend more time depressed than men with bipolar disorder. Bipolar disorder usually develops later in life for women, and they're more likely to have bipolar disorder too, and be affected by seasonal mood changes. A combination of medical and mental issues is also more common in women. Those medical issues can include thyroid disease, migraine, and anxiety disorder. I have migraine and anxiety disorder. I don't have the thyroid disease. My wife actually was diagnosed with Graves' disease, and they had to take her thyroid out. They had to cut her throat and take her thyroid out, so she has no thyroid. So she is actually on medicine for her thyroid, and if she don't take her thyroid medicine, she could die because your body needs thyroid hormone. Some things that make you more likely to have bipolar disorder include having a family member with bipolar disorder, going through a time of high stress or drama, drug or alcohol abuse, certain health conditions. Many people with the condition abuse alcohol and other drugs. When manic or depressed, people with bipolar disorder are more likely to have seasonal depression, coexisting anxiety disorder, post-traumatic stress disorder, and obsessive compulsive disorder. I have post-traumatic stress disorder from my childhood and other things that happened in my life, so bipolar disorder. Diagnosis. If you or someone you know has symptoms of bipolar disorder, talk to your family doctor or a psychiatrist. They will ask questions about mental illness that you or the person you're concerned about have had, and any mental illness that run in your family. The person will also get a complete psychiatric evaluation to tell if they have likely bipolar disorder or another mental health condition. Diagnosing bipolar disorder is all about person's symptoms and determining whether they may be the result of another cause, such as low thyroid, or mood symptoms caused by drug or alcohol abuse. How severe are they? How long have they lasted? And how often do they happen? The most telling symptoms are those that involve highs or lows, moods, along with changes in sleep, energy, thinking, and behavior. Talking to close friends and family of the person can often help the doctor distinguish bipolar disorder from major depressive disorder or other psychiatric disorder that can involve changes in mood, thinking, and behavior. Diagnosing bipolar disorder can be trickier in children and teenagers. Their symptoms may be the same as adults, but might be confused for attention deficit hyperactive disorder, ADHD, or even just bad behavior. If you think your child might have bipolar disorder, ask your doctor for a referral to a child psychologist who's familiar with bipolar disorder. Okay, treatments for bipolar. Bipolar disorder can be treated. It's a long-term condition that needs ongoing care. People who have 4 or more mood episodes in a year, or who also have drug or alcohol problems, can have forms of the illness that are much harder to treat. Medication is the main treatment used, usually involving the following: mood stabilizers such as Tegretol, Lamictal, lithium, and valproate, which is Depakotate. Sorry, I know I murdered them, but antipsychotic drugs such as Seroquel, Vralo, Latidud, sorry, antidepressants, antipsychotic drugs, a combination of an antidepressant and a mood stabilizer, anti-anxiety medication or sleep medication such as a sedative like benzodiazepine. It can take a while to find the right combination for you. You may need to try a few things before you and your doctor figure out what works best. Once you do, it's important to stay on your medication. Please, stay on your medication and talk with your doctor before stopping or changing it. This medication is the same as ADHD medication. I don't know if anybody deals with ADHD. I don't personally, but I do have, my 2 older sons have ADHD. And if you stop their medication cold turkey instead of winging them down, it will cause more harm than good. This medication is the same. You need to be winged down and do not stop it cold turkey, because it will mess you up. So, women who are pregnant or breastfeeding should talk with their doctors about medications that are safe to take. Psychotherapy or talk therapy is often recommended too. There are several different types. Options can include interpersonal and social rhythm therapy, ISPRT. This is based on the idea that having a daily routine for everything from sleep to eating can help keep your mood stable. Cognitive behavior therapy, CBD. This helps you replace bad habits and actions with more positive alternatives. It also can help you learn to manage stress, other negative triggers. Psychoeducation. Learning more and teaching family members about bipolar disorder can help give you support when episodes happen. I do the routine from sleep to eating, whatever. I start them routines when my kids are babies. I get them on a routine so they know what's coming next. They don't have to worry about what's coming next. They know. I do that for them. Not so much for me. I'm really not on a routine. And I've never done the CBD. CBT, sorry, or the well, I guess I am kind of doing these videos, but, um, so, family focused therapy. This sets up a support system to help with treatments and helps your loved ones recognize the beginning of an episode. I really don't do that either. I mean, when I do my therapy, I tell my wife what's going on, but that's about it. I mean, she knows when an episode's coming on and everything, so, but I guess I really don't do that either. Um, Other treatment options for bipolar disorder can include electroconvulsive therapy, ECT. Small doses of electricity shock the brain and set off a small seizure to kind of reboot it and change the balance of certain chemicals. While it's still a last resort treatment when medications and therapy haven't worked, it is much better controlled, safer, with fewer risks and side effects than in the early days of this procedure. I don't know if anybody still does that. I really don't know. I haven't been to a therapy that does it, so I'm not sure. Acupuncture. There's some evidence that this complementary therapy may help with the depression caused by bipolar disorder. I've heard acupuncture works. I haven't done it. I don't know if I could. I don't like the idea of small needles being entered in my body, all over my body, so no. But some people says it works. I don't know. Supplements. While some people take certain vitamin supplements to help with the symptoms of bipolar disorder, there are many possible issues with using them. For example, their ingredients aren't regulated. They can have side effects, and some can affect how prescription drugs work. Be sure to tell your doctor about any supplements you take. If you want to start taking a supplement, please talk to your doctor before taking it, because the supplement you take can counteract your prescription medication for your bipolar disorder, whatever's in your supplement. So please ask your doctor before you start taking a supplement if you're on medication, because like I said, it can counteract your prescription medicine. It's almost just like birth control. There are certain antibiotics you take if you're on birth control pills. It will count. They tell you to watch because it will void out your birth control pill to where your birth control pill won't work. Kind of the same thing. So please talk to your doctor before you take any supplements. Lifestyle changes may also help. Get regular exercise, stay on a schedule for eating and sleeping, learn to recognize your mood swings, get support from friends or groups, keep a symptom journal or chart, learn to manage stress, find healthy hobbies or sports, don't drink alcohol or use recreational drugs. Okay, and as I said at the beginning, having bipolar disorder, people may become suicidal. If you have somebody that you think is suicidal, have told you they don't want to live anymore, have told you they want to kill themselves and everything else, please help them seek help or have them call the suicide hotline. If you notice they're isolating themselves, they're de- depression's gotten worse. There's change in eating, sleeping, activities. They talk about suicide. They think it's, they have hopelessness. They have helplessness. Um, they act recklessly. They're taking more risks. They're using alcohol and drugs. They're focusing on morbid and negative themes. They're talking about death and dying, crying more, or becoming less emotionally expressive, giving away possessions. Any of them are warning signs. Please get them help. Have or call the suicide hotline. There's hope out there. Please get them help. I've been there. I've had suicidal thoughts. It does get better over time. I still have them sometimes when I just am in a rut and I feel like there's no way out besides that. But there is. Um, if it wasn't for my wife, my kids, my family being there supporting me, there's times I don't think I would have made it through it. But you'll make it through. You will. You are a lot stronger than you give yourself credit for. Trust me. I don't think I'm a strong person. And there are times my wife has to remind me that I am. I'm reminding you all, you are strong. You will get through it. You will conquer it. So please, get help if you ever think about taking your life. Because trust me, it's not worth it. You will get through it. You will find a reason to get through it. If anything, talk to your parents. And if you don't have the support you need, you can always comment below. And I always leave my email on the description. Email me. I'll be your support. I'll help you get through it if you don't have the support you need. So, that's bipolar disorder. I'm sorry if you all heard any noises in the background. It was my kids. They decided to fight over everything today. So, but if you all need me, you can email me, comment below. If you like this video, please give it a thumbs up. Please subscribe to my channel. And as I said in the beginning, if you have any requests and you want me to do a video on any requests you have, whether it's mental illness, whether it's a sickness, whether it's this, whether it's that, I will do a video on it. So just let me know, drop it in the comments below. And if you like my videos, give them a thumbs up. So, and I'm thinking about going live next week on YouTube to see if anybody needs any to talk about, you know, the 2 videos I just did, which was borderline personality or bipolar disorder. So I'm thinking about going live next Thursday to do that. So, yeah. But you all have a wonderful day. Thank you for watching Support Talk with Cecilia. Y'all have a wonderful day and take care of yourself. And remember, be yourself.